My name is Rachel Bugenhagen, and first off, I want to give you a little insight into my daily life and activities. Um, I grew up and live on a hobby farm, so chores and yard work are something I do every day. Um, Sports and athletics were a big part of my growing up through grade school and high school. Um, my faith in Christ as my Savior it plays a huge role in my life. I coach girls' grade school basketball, and I'm very active at my church. I volunteer on a regular basis. And if you meet me anywhere, I'll always greet you with a smile and say good morning or hi and ask you how you are. For the past 2 years, I have been a full-time professional dog trainer, and I'm really good at it. I did do really well in high school, and I've graduated college. And based on all that I've done and all that I do, very few, if anyone, ever suspects that I have severe depression. So I want to take you on a brief journey through what having depression is really like, because a lot of times we have this preconceived belief of what depression should look like. Society thinks of depression as something that should be gotten over or cured or just brushed off. And people who have depression are often labeled as lazy or weak and selfish, dramatic and attention seeking. But a lot of times, the fully functional person sitting next to you at school or work, at a football game, or at church, those are the people who are really struggling with depression. And I want to talk about what we can do to help those people struggling with depression. No. So I was officially diagnosed with depression in May of 2013. I was put on antidepressants immediately, which set off the beginning of a horrible year of hospitalizations and crises. My medications were switched around quite a bit, and I never found the right combination in that first year. Every antidepressant they put me on caused me to be suicidal. Every anti-anxiety medication caused me to have panic attacks. The sleep medications they put me on either kept me up all night or left me groggy all morning. I self-harmed a lot, if almost daily. I bear the scars of that on my arms and legs. And I made a lot of attempts on my life in both serious and not serious. And college was extremely difficult because of the anxiety attacks, uh, not getting the right amount of sleep, and just the depression getting worse and worse. In that first year, I underwent standard psychological testing, and the test revealed severe major depressive disorder, really bad social anxiety, and general anxiety. On March 28th of 2014, I had to go to the ICU with sepsis. And the 10 days following that, I was in the hospital with pneumonia. And upon discharge, they discovered pneumono, and that my spleen was enlarged, and it was hurting really bad. On April 29th of 2014, I didn't believe that life was worth living anymore. I didn't have my mental health or emotional health, and at that point, my physical health was gone. And that night, I overdosed on 59 prescription sleep pills. And by every right, I should have died that night. But I woke up in the ICU 2 days later. But through that incident, doctors discovered that I have Hashimoto's thyroid disease. So that's when the antibodies inside of me are attacking my thyroid. And for a lot of people, that can cause depression. And upon learning that, I demanded to go off of all of the psychiatric medications that I was on. And while my thyroid has since been well regulated and still is. I still had a lot of ups and downs since then. In 2016, I was diagnosed with POTS, and that's postural orthostatic tachycardia syndrome. And that is when one's autonomic nervous system does not work properly. So everything inside of you that should work automatically, like your heart rate, your blood pressure, thought processes, equilibrium, blood circulation, none of that works normally for me. So I went to see a neurologist about it, and he couldn't fully help me, so he sent me to the Mayo Clinic. And they have a month-long program to help people get over or get through it and help regulate their POTS. And that really did help me, and my POTS only minorly bothers me now. But upon intake and discharge, they have a series of tests that they run you through, and one of those tests kind of measures the level of depression that you have. For them, a 1 is very low, almost non-existent, and a 20 is really high. You should be seeking medical attention, maybe even be in the hospital. And mine was at a 50, so it was really quite high. And after that program, I just continued to battle myself by myself until the late fall and winter of 2018. And that's when I began to be very suicidal again. I began to self-harm almost daily, and I made a lot of attempts without telling anybody, and I didn't seek medical help. I reached this point of total hopelessness, and I was begging God to take me home every single night and pleading with him to not let me wake up. And after a huge breakdown at work, I called my therapist and asked her what I should do, because I couldn't be on medications without being suicidal, and now I couldn't be off medications without being suicidal. And she told me just to go to the hospital, just to be safe. And from January until June of 2019, I was in and out of hospitals and programs trying to find the right help. And I was re-diagnosed, adding borderline personality disorder to the list of diagnoses. And my depression was now labeled persistent because of how long that it's been bothering me and how consistently and constantly it attacks me. I am back on medications now, and as of right now, they are stable. They are helping. And while I know that I'll never be 100%, I'll never be completely over this, I'm okay with that. I've accepted that depression it's going to be a part of the rest of my life. But I can continue to fight. So in total, I've been in 4 hospitals, 17 programs, and I've seen well over 100 medical professionals. And my official diagnoses are severe high functioning, persistent depressive disorder, social anxiety, borderline personality disorder, and general anxiety. And I have thankfully found really helpful treatment, but I know this war will not be over. So now what depression is really like on a daily basis. When you live with depression every single day, just the thought of getting out of bed, it is really, really hard. We wake up exhausted. because we spent the night fighting. And the only thing I can really compare it to is if you've ever had the flu really bad. When you have the flu, you are exhausted all the time because your body is physically fighting off that illness. And that's how it kind of feels to fight depression. The only difference is your body can physically fight off the illness because you have your immune system fighting that off. But with depression, the battle's in your head and your brain doesn't have an immune system to fight it off. And so when we're trying to get out of bed in the morning, we're having to deal with that fatigue. And once we are starting to try to get out of bed, we have to think about all the things we need to do to get ready for the day, all the things we need to accomplish in the day, everything we didn't accomplish yesterday, the things coming up this week, this weekend, and it can become very overwhelming. So all we want to do is stay curled up in our bed and go back to sleep so we don't have to deal with any of it. So even the task of getting up and getting ready for the day, that is an accomplishment. Getting through the day is just as difficult. There's work for those of us who have a job, and there's school for students. We struggle with eating right. We try to put on this brave face for those around us, which takes a lot of effort, especially on our worst days. By the time we come home and try to accomplish anything, or try to wind down, we don't have the energy. All we want to do is rest or go to bed. There is something called high-functioning depression, which, if you remember, that's part of my diagnosis. It's when you have depression, but can still do normal things. It's what my depression is. I can go to work. I go to church every Sunday. I volunteer a lot. I help my family do chores. It's, quote, normal things. But there was a point when I was in a program and sitting down with a therapist, and she told me to my face that my depression must not be that bad because I can do all of those things. And while I was sitting there with her, I was suicidal. So you really cannot judge someone's level of depression based on their level of activity. Another thing that I don't think people realize is just how constant the negative thoughts are. At least for me, the thoughts do not stop. I can walk into any room, say the bathroom, and come up with 20 ways I could hurt myself or end my life. I won't, but the thoughts are there. And then there's the constant negative thoughts that will berate and belittle me. And this makes me my worst enemy. And then anything that is said negatively toward me, it's just felt even more heavily because my brain will take all those negative things and it plays it at max volume on repeat for hours and days and weeks for a very long time, and it just makes it a constant war. And I can win a battle 1 minute, and then in the next minute I'll lose. It doesn't stop. Lack of concentration and poor memory are another symptom, especially when it comes to remembering fun events and good memories. So please don't make us feel bad or press us when we can't remember certain things that happened. Depression is a relentless monster, and you can't fight it on your own. Whether that means a friend you trust helps you, or your spouse, your siblings, your parents, a therapist, a pastor, someone has to help you. Depression cannot be fought alone, and I know this because I used to fight it alone, and it's really hard, almost impossible. And there are still times when I try to fight it alone, and it's really hard. Depression convinces me that I'm a burden, that no one wants me around. I'm a failure, I have no future, and I believe it. I shouldn't, but I do. And that causes me to isolate and not reach out. It makes me hide my symptoms behind a mask that tells everyone that I'm doing just fine, that I'm okay. But that's a lie, because I'm nowhere near being fine. And this isolation leads to a debilitating sense of loneliness. I can be sitting around my family or friends and still feel completely alone. And that's the hardest part about depression, is that admitting that you need help, that ability to be vulnerable. It's the hardest part. Believe me, um, if I hadn't been able to be vulnerable, I would never have reached out for help, and I never would have gotten help. I definitely wouldn't be giving a public webinar presentation. And I can honestly say I don't know if I'd be alive today if I hadn't allowed myself to be vulnerable. So for anyone who is struggling, don't hide. And if you know someone who is struggling, let them know that you are willing to listen and that you care about them. Things like this, will make a huge difference. You can still function with depression. The main challenge is finding the right treatment and the right support. Those things are key when you're struggling. I could probably quote to you every single distress tolerance skill as it appears in a mental health handbook. But what good is that memorization if I don't have someone to hold me accountable to it? On the flip side, what good is having someone who will support me if they don't know how to support me? You need both. There are multiple treatments for depression. The most common form is medications, and believe me, there is a plethora of them. And it takes a lot of trial and error and a lot of patience to find the right ones. But sometimes medications are not the right course of action. There's also talk therapy and group therapy, which are primarily led by a therapist. There's CBT and DBT, which are primarily used in specialized hospital programs, but therapists will sometimes use different skills from these in individual therapy sessions. And ECT and TMS are used for very extreme cases. Knowing that these are the main treatments for depression, the biggest questions that loved ones ask are, how can I help? And there's a few things that we can do. You can say that I'm willing to listen and I'm here for you. Even if you don't understand exactly what they're going through, having them know that you're there is extremely helpful to them. And parents and teachers, this one is huge for you. While it may be easy to assume that kids and students know that they can reach out, such assumptions can lead to kids not getting the help they need, because you never know which kids have been let down in the past. Speaking from experience, I currently have a hard time reaching out to new friends because in the past, I've had a lot of friends leave because of the depression. But having someone come up to me and say, I am here and I want to listen, I want to help, that's huge for me. We also need to invite people out to small social gatherings or out to dinner, out to a movie. But I want to emphasize that it needs to be small because sometimes a big social gathering can be a trigger for them. The reason we want to get them out of the house is because getting someone out of their immediate space can help clear your headspace. We need to check in with them, not constantly like an overbearing parent, but just to let them know that you're there, you're thinking of them. And for parents, don't just text your kid, ask them how they're doing. Sit down with them and really talk to them. And teachers, Watch for kids that may be struggling with school, or they seem distracted, or they're not doing quite as well in their work as you think they can be doing. Just checking in with them. And if a friend of yours keeps canceling plans, ask if they're really okay. We need to not belittle and berate our loved ones. This means being aware of what we're saying and how it may affect someone. So things like it's all in your head or mind over matter, happiness is a choice. Saying things like this can be detrimental to someone because you have to remember that people with depression are already being really hard on themselves. We don't want to make it harder for them. Praying for someone can mean a lot, and I know that prayer isn't a magic cure that's going to fix everything, but when you know that someone cares enough about you to pray for them, it can make a huge difference. Saying, I forgive you, you'd be surprised how far this can go. When you have depression and you do have days or times when you regress, you're scared to tell someone because you think that they're going to be really mad at you. But having them say, I forgive you, that just eases the burden a lot. You want to find what they enjoy and do it with them, even if it's not something you're good at or fond of. It shows them how much you care. Encourage them to seek treatment, even if they're resistant at first. It shows them that you want the best for them. We need to encourage mental health the way we do physical health. Think about it. How often do you hear people talking about washing your hands, especially now, taking your medication, getting a flu shot, or brushing your teeth? Why don't we do the same thing with mental health? How do we treat failure, loneliness, rejection, rumination, depression? Why does a 5-year-old know that you put a band-aid on a cut, but a teenager doesn't know how to deal with loneliness or rejection? I watched a really good TED Talk about practicing mental first aid. While mental health isn't something you can just put a band-aid on and call it good, the speaker says we need to do a better job of encouraging mental health as much as we do physical health. Telling someone that you care about them, that they make a difference in your life, even if they contradict you or deny it, telling them that gives them something to hold on to. Another thing that we can do to help prevent the increase in depression in students and teenagers is listening better to them. If they say they are struggling with something or they seem extra emotional, don't always brush it off as typical teenage emotions. Sit down with them. Sincerely ask them how they're doing. Ask if they need to talk about something, and sometimes it may take a few times of asking. But when they do come to you and really need to talk, actively listen to them. And also for teenagers, try to find some time away from the electronics and put aside the social media. So we do need that break. We need to recharge. Find some time to engage in a hobby that isn't related to social media. We always need that break in our lives to not know what's going on in the world with everybody else. You need to take time for yourself. Saying that you love someone no matter what is very hard for someone with depression to feel love and express love. So it's important to tell them that you do love them, even if they are struggling a lot. It really goes a long way. What if you feel like nothing you're doing is helping? It's really important that you do not give up, because the moment that you give up could be the moment that they give up. Keep trying to engage them, reach out to them, and sometimes it may feel like they're pushing you away, but that may not always be the case. It is also very important that you be patient and remember that the medications and therapy isn't going to work overnight. There will still be bad days. And when those bad days come, you need to be there. And if they do regress into self-harm, don't get upset or angry. They only want to know that you forgive them, and they will continue to be there for them. There are a lot of other kinds of help out there. There's crisis lines, warm lines, and hospital programs. However, there may be times when it does become necessary to call 911. If someone you know is talking about suicide or is making threats, you need to call. Speaking from experience, they will probably not be happy with you after you do this, but you need to think about their safety. And in the long run, they will thank you for saving their life. So what have I learned from all this? People are blind, stubborn, proud to the point of not getting help. It's a sad fact, but it is true. You will run into people who will let you down when you need someone to be there as a friend. I could name for you every friend I've lost because of the depression. They chose to leave due to their blindness. There are also some people who are too proud to seek treatment, and that can be for several reasons. Men are actually less likely than women to seek treatment due to the labeling of depression as a sign of weakness. Men don't like to feel vulnerable. There are also people who honestly do not believe that they need help. They don't see their struggles as real problems. This will go back to patience. Whether the person in your life is blind to what you are going through, stubborn about getting help for their own sake, or too proud to think that there is anything actually wrong, patience is key. Getting the help you need requires vulnerability, which is extremely difficult, but it is very worth the result. You cannot fight depression alone. It requires an army of people beside you, because depression is a war, like I said. In a war, you need allies, and that means your family, your spouse, trusted friends, a therapist, anyone around you who will help. You need those allies. And to be honest, we will lose battles with our depression constantly, and it's inevitable. But in the end, it's the war that matters. Throughout my journey, I have learned to become very dependent on God, where I might not have before. My faith was challenged to the extreme. I spent many nights in fervent prayer, sometimes yelling at God, pleading with Him, begging Him to help me, heal me, guide me, fix me, or even take me home. If I didn't have depression, I would not have the kind of relationship I have with God. I have learned to fully trust His will and trust His love. I can never know what would have happened if I'd grown up without depression. All I know is what my story is right now. And right now, God has given me the chance to help people like me, and I am taking that chance and running with it. And before I wrap up, I would like to share one of my favorite Bible sections, which has helped me and comforted me during my battles with depression. And it comes from Psalm 139, verses 1 through 12. O Lord, you have searched me, and you know me. You know when I sit and when I rise. You perceive my thoughts from afar. You discern my going out and my lying down. You are familiar with all my ways. Before a word is on my tongue, you know it completely, O Lord. You hem me in, before, behind, and before. You have laid your hand upon me. Such knowledge is too wonderful for me, too lofty for me to attain. Where can I go from your spirit? Where can I flee from your presence? If I go up to the heavens, you are there. If I make my bed in the depths, you are there. If I rise on the wings of the dawn, if I settle on the far side of the sea, even there your hand will guide me. Your right hand will hold me fast. If I say, surely the darkness will hide me, and the light will become night around me, even the darkness will not be dark to you. The night will shine like the day, for darkness is as light to you. This section is so comforting to me, because even though there were times when I thought God had abandoned me, or that I had run too far away, or that the depression had gotten too horrible. This section tells me that that isn't possible. God knows me, every thought, every action, and there is nowhere I can go where He isn't already there waiting for me with open arms. Even the darkest of nights are as bright as day to Him. If anyone's waiting with questions now, I'm ready for them.
Thank you, Rachel. That was incredible. That was really, in addition to being heart wrenching, it was so tremendously honest and beautiful. I'm just at awe. So thank you again. Um, the question I have a number of questions I have, and then a few questions that are actually coming in. Um, when you were first diagnosed, I saw that you had this series of hospitalizations, and some of them, it looks like there were some medical causes like pneumonia, thyroid issues. Were all of this really real, or how much of that you think may have been due to your depression and your mental health situation? Do you have a way of telling me? Do you have a way of saying?
But looking back, I probably had the depression like through my childhood and up through high school, but I wasn't diagnosed officially until college. And it was in college that I was diagnosed with the Hashimoto's and then I got really sick one day and had to go in with sepsis, and then I had mono and all of that. So those were completely separate from the depression.
Mm-hmm, mm-hmm. And I think that we as clinicians, like sometimes when we see a patient who have physical illness, we often tend to overlook the fact that there may be some emotional, psychological issue behind it. And I truly believe that a significant part of our training as physicians is really centered around the body. And
Mm-hmm.
I'm going to take straight to the comment that you've made about mental illness and physical illness, how it's easy to put a band-aid on a cut, or it's easy to deal with a broken bone or an increase in blood sugar, but then realize that there are some emotional component that may actually present behind the scene that may be the cause or contributing to the cause that we tend to miss. And I truly believe that not only that the knowledge of mental health and physical health is, is really defective in terms of how we are educated as physicians and how the community view each one of them. But I think unless we really bring mental health, like you said, to the level of where physical health is,
Mm-hmm.
we will not be able to really do what I think needs to be done to help everyone and to really take care of a lot of medical illnesses
Mm-hmm.
that we deal with on a daily basis.
Mm-hmm. Yeah, definitely.
Yeah. One question I have here from about how does the current situation of social isolation and the COVID-19 have really impacted your day-to-day life?
In some ways it has, and in some ways it hasn't. For me, myself, I am very introverted. So I never really went out to begin with. So having to stay home
Uh-huh.
was okay. Um, but when I was first sick, I was sick for a month at the beginning of all this, and that was really hard. Um, but I think it has to do with like I live on our hobby farm yet. So being able to go outside and be in nature, play with my dogs, like that helped me a lot. Otherwise, I think it would have affected me a lot more than it has. Because I know when our church was closed, that had a huge effect on me because church is like a second home to me. That's my family. I I love the people there. I love seeing them. I love participating, and so that had a huge effect on me. Um, the other, so it affected me and didn't affect me. So
Mhm.
it's making do with what you have, which is a lot of things that therapy has taught me. To take the situation that you have and try to be happy in it as best you can.
A question about talk therapy. Do you still see a therapist face to face? Do you interact with a therapist online now, or? Uh,
Yeah, my therapist is available via telehealth, so I've been meeting with her um, almost like every other week. I've been seeing her.
mhm. Um, the comment that you made about you're not you can't fight this alone.
Hmm.
Uh, being open and being honest about it and share your story, uh, uh, really in a way is inviting people in to be part of the journey and to be helpful. Who was the most helpful individual in your life that really made a difference and help you go through this battle? Was there any particular individual that really made a difference?
I think it's been different people at different times. Um, so there was a friend when I was in high school who's no longer a friend. He was really helpful at the time. There was a friend in college who was really helpful at the time, but he's no longer around. Um, and I'd say right now I've been a lot more open with my parents, and like two of my pastors are probably great supporters. My sisters have actually been really helpful. Um,
Another
yeah,
question.
it's been a lot of people.
Thank you. That's awesome. Another question is, I noticed that you live on the farm, like you've said, and you interact with the animals and nature, and that's really very helpful. Have you done any physical exercise? Have you felt that uh, any physical activity really helps, and have you tried that?
Yeah, like I said, I through grade school and high school, I played a lot of sports. Um, looking back, that probably helped me a lot. Um, when I got to college, I kind of stopped any physical activity, which could be why the depression manifested itself so much more. Um, but lately, I've been trying a lot harder to be a lot more active. Um, after I was after the month that I was sick, I spent a whole month doing extensive yard work. And then once I was done with that, I started to try to pick up running again, and I've been listening to my body with that because I've gotten really severe shin splints. So I think I gotta get new shoes. But um, yeah, and I go on walks with my dog and
Hmm.
just trying to find any way I can be to be active because I think like athletics have always been a huge part of my life. So I think my body's just saying, "Hey, we need to get back into this."
Yeah, yeah. I think that the message that I really heard you very, very strong and powerful is that don't give up.
Hmm.
And I think that's the key, and that's the key message that we have to everyone out there who suffer from mental illness, is that don't give up. There is
Hmm.
help out there, and there are. You may, like you said, you'll have this for the rest of your life, but you know how to live with it, and
Hmm.
you know how to deal with it. So the 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 uh, the fact that there will be a lot of trials and errors between medications and
Mhm.
therapists, and it clearly looking at your history, you've had quite a bit. So let's say
Yeah.
how many medications have you been tried on before you actually got to the mixture that really worked for you?
I honestly couldn't say because that first hospitalization um, back in 2013, I was in the hospital almost the entire summer, and they were switching medications almost every other day. I don't even know which medications I was on.
Okay.
So I honestly don't know how many medications I've been on.
Right. But finally, to get to a regimen that really worked for you, it took a
Yeah,
lot of trials and errors.
it did.
So message to those people who are struggling with medications is that
Hmm.
ultimately the right mixture will be there, and there will be something out there that to help them,
Hmm.
you know. But the key is don't give up,
Yeah,
and
a lot of patience.
a lot of patience, a lot of
Hmm.
patience. Yes, yes. I think we're at the end of our discussion here, and it sounds like we've covered all the questions that we have. Um, Rachel, I can't thank you enough for stepping up and sharing your story, and I'm letting everybody know through the message that you're delivering that they're not alone, that they must not give up, that there is help out there, and I know what we need to all do when we have a friend or relative who suffer from mental illness, and the things that we need to do to let them know that they are loved, that they are cared for, that we are out there to help them through this very challenging and difficult battle. Uh, for all of you who are watching and listening, I thank you so much for joining us on this webinar. There'll be more to come on people who are stepping up to share their stories. If you are interested in sharing your stories, please reach out to us on our Facebook or through our website. So thank you so much for joining us, and I look forward to seeing you in future webinars.
Thank you.